Welcome back to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today is my friend, Dr. Henri Ford, a fellow regent in my class of regents, in fact, as well as Dean down the street from me at the University of Miami. Welcome, Henri.
Thank you so very much, Steve. A pleasure to be with you once again.
Absolutely. Great to have you back. This time, I'd like to start chatting with you about COVID here in South Florida. You're in a very unique situation being dean of medical school, where one of the major teaching campuses is also a safety net public hospital. So there's a few perspectives perhaps we could address with this current surge. First of which, are things getting better?
Well, unfortunately, right now, things are not getting better, although we think they may be reaching a plateau. But this surge has been extraordinary. We have seen a significant rise in the number of hospitalized patients, which rival where we were last year at this time, at the peak of this pandemic. Not only that, we've also seen a significant increase in the number of ICU patients that we've had on the ventilator. And so consequently, that has created a little bit of a scare for us because we are limited in our ability to continue to do elective cases. So we have now been prioritizing to ensure that we have enough beds available to meet some of the pressing needs of the non-COVID patients, while at the same time making sure that we can care for COVID patients. The surge has also forced us to modify our approach in the School of Medicine. For one thing, the white coat ceremony, which is this extraordinary tradition that usually features students, parents, faculty, staff. We've had to modify it in order to restrict the number of people who could attend. Unfortunately, that meant we had to tell parents that they could not be present for what is one of the most unique, amazing, electrifying traditions when you formally transition the student from a pre-medical student to a medical student. And the symbolism is quite important. And this is one that I know parents usually value tremendously. But this year, again, because we see our ICUs are full, our hospital beds are bursting, our hospitals bursting at the seam with patients, we could not take the chance to make this yet another COVID spreader. And so consequently, we had to modify this. Although all of our students have to be vaccinated, in order for them to be in the hospital.
So as we're talking about some of the specifics, mandatory vaccinations for students, for example, maybe we can touch on some other themes that you raised in terms of the ICU. So what percent of the ICU are COVID patients, as well as if you can share what percent of the hospital overall? And then within those statistics, so the younger population, older population, vaccinated, not vaccinated, these are all the questions people have as they look to us here at the epicenter, seemingly, of the surge.
Sure. I mean, I think at this point, almost half of our ICU patients are COVID patients. And the vast majority are unvaccinated. Those patients who require hospitalization in the ICU, they tend to be some of our immunosuppressed patients. But even they actually have a shorter course, a shorter stay in the ICU compared to the unvaccinated patients. And unlike last year, indeed, most of the patients who are coming into the ICU are younger patients. And so clearly, unvaccinated patients are the ones who are filling up our ICU beds and our hospital beds, period. This has brought us to mandate vaccination for all of our employees. And this is something we try to refrain from doing and so forth. But at the end of the day, we have a responsibility towards our patients and everyone else in South Florida to make sure that we can keep the doors of the hospital open. And so we had to mandate that all of our employees, regardless of their roles, be vaccinated. And of course, we've always mandated that everyone wears a mask in the hospital, and that's continuing. And so for medical students, if for whatever reason someone were to say, well, I don't want to be vaccinated or I have some other issue, these students have to take a leave of absence until COVID dies out, because the hospitals will not allow them to come to do their rotations without the vaccination. So this is they're pretty stringent.
Are you still testing all patients, even if they've been vaccinated?
Just about anyone who's going for a procedure is getting tested.
Okay. Well, the mandatory vaccination issue and here in Florida, the mask issue are both sort of hotly debated, as you know. But another issue that's come up besides vaccines and masks is delay in diagnosis. Jackson is one of the nation's premier safety net hospitals, as it were. Well, what have you seen since March of last year, particularly things like colon cancer and breast cancer?
Sure. Without question, there's been a delay in diagnosis in many cases, and people presenting with more advanced disease, in part because they were reluctant to come to the hospital. They were afraid of catching COVID, or in some cases, we really had decreased capacity, even though we were offering telehealth, and that's become a significant component of our approach to healthcare. Having said that, people now are being denied access because the hospital beds are full, and we have to once again limit elective cases. So people are being pushed back, months in order for us to deal with the acutely ill patients who are presenting with respiratory disease. And it's unfortunate because this is something that could have been prevented. And I think that's a frustration for all of us who are involved in healthcare.
One of the other impacts, and you mentioned it a bit with the med students having to A, be vaccinated, or B, take a leave of absence, and the white coat ceremony. Have there been changes in the curriculum for the med students or for the residents because of COVID?
Right. Without question, we had to change our approach. And we believe in a small group teaching, and the curriculum is designed to break up the students into groups of 10 to come up with answers and to teach one another. And we've had to modify it to make it virtual. So they end up breaking out in virtual Zoom rooms where they'll get a problem and try to solve it and try to do the research. But you lose some of the team dynamics when you're on Zoom. And I think that's been one of the frustrating aspects of being able to deliver this fairly novel curriculum that we implemented last year during the pandemic. But we're doing our best. Fortunately, our students are resilient and they are adaptable, and we are still able to move forward. And now they are entering their clinics in the second year, which is an exciting progress. It's an earlier introduction to the clerkship year, but we think that they are still very well prepared, despite the fact that we've had to modify our approach to teaching.
One of the other things that I'd read, and I don't recall the source, was that there was an increase overall in the number of medical school applicants over the prior preceding years. So could you speak to that?
Sure. Well, everyone calls it the Fauci effect. Without question, the number of applicants to medical schools was increased by somewhere close to 20% across the country. We saw a 30% increase in the number of applicants that were seeking admission to the Miller School of Medicine at the University of Miami. And then we certainly welcomed it because these were they were very, very talented. The new class that that just started boasts the highest average GPA and the highest MCAT scores in the history of the Miller School. So it's great to see that we have very talented people applying to medical school and deciding to become a doctor, presumably as a result of the Fauci effect, his presence over all of the news media and just constant education of the US population and his forceful advocacy for public health, I think has made a significant difference. Now, we also saw a significant increase in the number of applicants to our Master in Public Health degree. So yes, across the board, the Fauci effect has led to an increase in the number of applicants to medical schools and public health schools as well.
So maybe some beneficial, what do you say, silver lining to the otherwise black cloud that, we've got more people applying to med school, which is good. We're more comfortable speaking to each other remotely, seeing each other as opposed to telephone conferences. So, maybe these are some things that work out. And that actually is my last questions relative to meeting with each other. You and I have now gone a year and a half with only virtual meetings on regions and regions committees and the like. What are you doing for travel with your staff for meetings, in-person meetings?
So we've had to impose travel restrictions once again in view of the surge. And the concern here is that because we are an academic health system, while we want people to be able to engage in scholarly activities and go give talks and attend meetings, the fact remains we need to have a critical mass of people to take care of the patients, especially when the hospitals are really full. And we cannot afford for people to be on a plane or go someplace and catch COVID and then come back and have to be quarantined. So that would create a real crisis for us in terms of healthcare personnel. So for those reasons, we have restricted travel, and anyone who wants to attend a meeting, we encourage them to participate virtually. And if someone feels that they absolutely have to go on a trip for whatever reason, then they need to obtain approval from their department chair, and the department chair can in turn consult with the dean if necessary. But we've had to make those types of changes, not so much to curtail people's freedom, but to ensure that we will have enough healthcare personnel available to care for the patients that we see.
Well, difficult decisions. Sounds like many difficult decisions have been made there with masks, with vaccines, with white coat ceremonies, curriculum, travel, but that's what good leadership's all about. And you're not a good leader, you're a great leader. You're doing a great job down there and with the college. I thank you for your time and your insights today.
Thank you so very much. Always a pleasure to talk to you, Steve.
Likewise, stay safe, stay well, and look forward to seeing you in person soon.
Sure enough. All right. Be well.